All right, good afternoon, everybody. Bear with us here as we're going to do a sound check with our panelists. So let me start with Scott Lindquist. Dr. Lindquist, can we hear you?
Yep, I am here.
Thank you so much. All right, and Melanie Brandt, can we hear you?
Hello.
Oh, thank you. All right, so hold tight, everybody. We'll wait a few minutes for the rest of our panel to join. All right, everybody, we will wait just a couple more minutes for our panelists to join. Thanks for your patience. All right, thanks everybody for waiting. Our panelists are on their way in, so we'll begin momentarily. Let's do another audio check. Dr. Mosseth, can we hear you?
Good afternoon. I'm here.
Thank you. Sounds good. Let's do a quick sound check. Deputy Secretary Ferenbach, can we hear you?
Good afternoon, everyone.
Thank you. All right, and let's do our last sound checks. Michelle Roberts, can we hear you?
Yeah, I'm here. I kept going back to the wrong room. Sorry.
Thanks, we've got you now. All right, and I think our last sound check, Dr. Shah, can we hear you?
Yeah, hi, I'm on.
All right, thank you. All right, just a second, everybody. We will get started. Actually, hold on just a moment. Are we expecting Dr. Fotinos?
I'm not sure she's coming on. She was told she didn't have to come on.
All right, thanks. Let's go ahead and get started. We can always add her in if we need to. So let me, I'm going to share with you all a title slide, then we'll pause for a few seconds and we'll get started with our live stream event. All right, and as we get started here, just a reminder to mute if you're not speaking. Thanks so much. All right, good afternoon and welcome to the Wednesday, January 13th, COVID-19 Response Media Briefing. I'm Frangie Mays, your facilitator for this event. I'd like to welcome our panel for today. We have Secretary of Health, Dr. Umair Shah, MD, MPH. We have Lacy Fehrenbach, Deputy Secretary of Health for the COVID-19 response. Dr. Scott Lindquist, State Epidemiologist for Communicable Diseases. Michelle Roberts, Acting Assistant Secretary, Washington State Department of Health. Dr. Kira Mosseth, COVID-19 Behavioral Health Strike Team. Dr. Charissa Fotinos, Deputy Chief Medical Officer, Healthcare Authority, to be determined. And Melanie Brandt, Chief Nursing Officer, Grays Harbor Community Hospital. To begin today's briefing, we will open with remarks from Secretary Umair Shah.
Thank you, Frangie. Thank you all for joining us. My name is Umair Shah. I'm the Secretary of Health, as Frangie just mentioned, for the great state of Washington, and it's my great pleasure to be here this afternoon. I am actually in Tumwater as we speak at Department of Health offices, and I wanted to really share a few things, some perspectives overall, and then I will turn it over to our team who are going to provide some additional details. We remain at a critical point with respect to COVID-19 response as both the public health and healthcare system, not just in the state of Washington, but throughout the country. And the fight against this virus means that we have a fight against the clock to get shots out, vaccines out to as many people as possible, and not just from the federal government to the state, from state to locals, locals to communities, but at the end of the day, from any of the vaccinators into the arms of people. The state of Washington has had one of the best responses in the country when it has come to COVID-19. That means that we've had incredible success previously. There has been no response that's been perfect, as we know, across the country or the globe. But the state of Washington should be proud. And when I say state, I mean the entirety of the state, our communities, our partners, state and local and tribal governments, all should be proud of the response that we've had. But unfortunately, we have had still over 275,000 cases of COVID-19 in our state, and we have had 3,789 deaths in our state as well. The promise of vaccine is what gives all of us glimmers of hope. This is what we have all been focused on over this last year, is when are we going to have something that is going to help us complete, finish, and defeat this virus. And that's what vaccines promise us. Like many other states, the start of our vaccine rollout in the state of Washington has been uneven at best. And yes, we have heard concerns from partners, from the public, from a number of different entities about the pace that we as a state are moving at. There have been many challenges to the rollout. Some of those challenges are simply out of our control, including that every state has had to figure out on its own in the absence of a national strategy. While those challenges have certainly impacted our response, ultimately it does not matter. Ultimately, our communities and people in our communities expect that they are going to get vaccines, and we are going to get those vaccines into their arms as quickly as possible. We have a fundamental responsibility to overcome these challenges and to simply get all of those challenges completed, overcome, and to get it right. That's what people want, and that's what matters. While we are making progress every single day, and our team will talk about that in the number of vaccines that are administered on a daily basis, I recognize that it has not been enough. Over the last several days, I have directed changes at the Department of Health level at our agency as we work with our partners to make sure we are able to deliver on the promise of vaccines and to do so quickly. One of those changes is an accelerated timeline for moving to even our next grouping, the phase 1B, which we expect to do in the next coming days. We have all been impacted by COVID-19 pandemic in a deep and personal way. Many people have experienced disproportionate impacts, unfortunately, of both COVID-19 and the unintended consequences of measures like closing businesses and schools and all sorts of other activities that have interrupted all of our lives. Vaccines still are the tool that ultimately will bring this pandemic to an end. Yet they represent still the promise if we can't execute on that successfully. They are hope and a way forward, and many people we know are waiting to get their vaccine to protect not only themselves, but the people around them. So many people in our state are at high risk for COVID-19, whether because of their job, their living situation, their health, their age, or other factors. And unfortunately, the reality is we just do not have enough vaccine for everyone who needs it right now. However, we are working hard to balance those needs with available supply and making sure we are distributing vaccine in an equitable way, again, as quickly as possible. Above all else, we are focused on getting as many people vaccinated as fast as possible. The federal partners of ours released in the media yesterday some additional information, and it left us uncertain on the path forward. We are still seeking clarity into the vaccine supply. What has not changed with yesterday's pronouncements in the media from our federal partners is that the vaccine supply for next week, for example, has not been altered. The key is getting more doses into states so those states can get them to local communities and into the arms of people. However, without consistent and enhanced vaccine supply, by making pronouncements, we are simply having people get into even longer lines, which only adds to the frustration and consternation of everyone and doesn't help us get vaccines administered. So while all of us want more vaccines into communities and the arms of people, we have to have consistent and enhanced supply of those vaccines from our federal partners. I had planned on doing and releasing a 100-day plan of visioning for my first 100 days in office as the Secretary of Health, and I was going to release that in the coming days. I have made the decision to push that off to a later time because I do not want any distraction from what we are focused on now, which is COVID-19 response and vaccinations. And we have to do everything we can to work together in order to increase the number of vaccines that are delivered to communities as well as administered to people in our communities. And that's what we're focused on. Later in this week, we're also focused on bringing partners together to have additional discussions on how we can actually achieve this together. And you will hear more details about that. I'm committed to ensuring that we do things better, we do things right, and we do things quickly. That is my continued commitment. That is the commitment of the Department of Health, and that is what all of our community members expect of us. Ranji, with that, I will turn it back to you.
Thank you, Secretary Shah. With that, next we'll go to Assistant Secretary Michelle Roberts.
Good afternoon, everybody, and thank you, Secretary Shah. It's been a really busy couple of weeks in the vaccine world. I'm Michelle Roberts, and I lead the COVID-19 vaccine planning and distribution team for the Department of Health. First of all, to all the healthcare, all workers in healthcare settings, I have a message for you. You need to get your vaccine, and you need to get it now. We are moving forward quickly, and we want to make sure that while we're still in phase 1A, you're taking advantage of having the first place in line. And now's the time to get that shot. If you haven't done it yet, the clock is ticking, so please make your appointment. To those of you still waiting for the vaccine or to see changes in the prioritization, we hear your concerns and your need for a faster deployment. We are committed to getting the vaccine to the people of Washington as fast as we can. So as Dr. Shah said, we'll be advancing the pace of phase 1B faster than originally planned, and we're eager to pick up the pace to get vaccines to people who need them. So let's talk about our numbers. As of today, as of the end of the day on January 11th, 201,660 total doses of vaccine had been given during phase 1A and reported to the state. That includes both the first and second doses of vaccine. As I mentioned last week, there was a delay in numbers that we are reporting each day as the data is collected from a variety of electronic health record systems. We know numbers are of the utmost importance in providing a clear picture of vaccine rollout in our state, and we're committed to providing as much data as we can. In just a few days, in partnership with Microsoft, the department will unveil a new vaccine statistics to its COVID-19 data dashboard. The vaccine data dashboard will allow you to see the total doses administered, the number of first doses versus second doses, and the percentage of the population that is fully vaccinated so far, including doses administered by date and more. We look forward to sharing that with you very soon. And finally, as we move into further vaccine distribution, like Dr. said, I just want to say we hear the feedback from the public, our partners on social media, and everywhere else. We know there's frustration with some aspects of the plan. This is the biggest vaccine campaign of our lifetime. And we have public health and the healthcare system and our community leaders working long hours to get vaccine out as quickly as possible. A learning curve is an undeniable part of rolling out any new program or health technology, and we are doing this in the middle of an emergency. We are committed to listening and adjusting our approach throughout this process. In closing, we expect to move into phase 1B in a matter of days. You'll hear more about this accelerated pace very soon. We're working on the details. Here's what we can say. Vaccine is a tool that will ultimately bring this pandemic era to an end. That is what will allow us to open our businesses, go back to school, and hug our friends. But there's a lot to do before we get there. We need to make sure people at highest risk of getting sick or dying get vaccinated first, and the rest of us will follow suit when it's our turn. That's what prioritization is all about. We are committed here in Washington to doing it right. Thank you.
Thank you, Assistant Secretary Roberts. Next, we'll go to Dr. Scott Lindquist.
Okay, I'm going to share some slides with you here. So, Frangie, if you could give me control to share. Thank you. There we go. Thank you. All right, so again, I'm going to give you some trends, but I'm going to give you some very specific concerns that we have in Washington State here. The trends are, numbers are as Dr. Shah outlined earlier, up over 266,000 on our webpage at this point. But again, the hot spots in Washington remain the same: Snohomish, King Pierce, Yakima, Clark, and Spokane. The darker the county, the higher the number of cases. So not much has changed here. We continue to have cases in the same spots throughout the state mainly. But what has changed is this very concerning blip in cases. So you can see one of the main concerns is we're at higher rates than we have ever been since the beginning of this in March. But we were very happy, and I talked about last week, a downward trend, which unfortunately has shown an increase again. And so many of our counties are showing this sharp increase. We don't know how far this is going to go. A reminder that these gray areas are not complete data yet. So we don't know if this is going to go way up here or if it's going to drop off. But the concern very clearly is we're having spikes in cases in many of our counties across the state. And so that falls back on the very specific guidance of wash your hands, wear your mask, and watch your distance, 6 feet distance. These are the tools that help us control disease. Vaccines are the light at the end of the tunnel, and it's great, and we're going to talk a lot about that today, but I'm going to bring us back to the 3 W's. Wash your hands, wear your mask, and watch your distance, because we have a spike in cases across the state, and we don't know where this is going to land. Those are the 3 tried and true measures that we can do. When we look at hospitalizations, it is not following that same concerning spike, but hospitalizations usually follow behind the increase in cases. So we remain at a flat or decreasing level of hospitalizations, with still a big difference between the older age groups, or the average, and our younger age groups 0 to 29, 39. So those remain flat or decreasing. So we will watch these carefully. A more detailed look at those hospitalizations do show, even though we're at a very high rate here, higher than we have been before, there is this downward trend. And again, where will this spike in cases across many of our counties in Washington translate into hospitalization impacts? That is unknown. So we're in a very tenuous position given the height of these bars as well as the trends of these bars. A lot of times people ask to predict out. We do work with many different modelers. These are the calculations of our projected cases through 118, which follows this same trend of upward cases. So we are not flattening out. We are continuing to rise. So that is, again, controlled with our social distancing, mask wearing, hand washing, and hopefully an effective vaccine. One of the things that we watch carefully is what is called the R naught, or the effective R naught. So the number of cases that are created by a single case of all the people that are susceptible, and anything below 1 is where we want to be. And you can see we dipped below 1, but again, that trend we are seeing has brought us across the 1 to a higher value, which means there's ongoing transmission. And at this point, we've seen big differences between the East and the West, and you can see they're fairly minimal now, but there's mild differences between the R naught or R effective across the state. Again, this increase here is a concern that we're seeing in case counts and what we're worried about. And with that, I will turn it back to you, Frangie.
All right, thank you, Dr. Lindquist. Next, we'll go to Deputy Secretary Lacey Ferenbach.
Good afternoon. Thank you, Frangie. Thank you all for joining. I just have a few brief updates today. We at DOH and we the public are all very focused on vaccine. Rolling vaccines out is unquestionably our top priority. And as you've heard Dr. Shah and Michelle mention, it is the tool that will help us end the pandemic and recover from both the pandemic itself and the secondary effects of the pandemic. However, as we work indefatigably to vaccinate Washingtonians, we at DOH and we as a community still need to use the tools we have to help us slow the spread of disease. And you heard about some of those from Dr. Lindquist. We also need to continue our public health efforts to test, isolate, trace, so that we stop the chains of transmission in our state, especially noting our rising cases right now. Related to this, we have some news about WA Notify, also known as exposure notification. This week, we began texting every person in Washington who receives a positive COVID-19 test result. When we text them, we give them a link. And if they are a WA Notify user, they can anonymously alert their close contacts. This new process gets alerts to people who have been exposed faster so they can get tested and begin quarantining earlier. On Monday, our first day of sending texts, 195 people we texted claimed their verification code for WA Notify. Our previous daily average for verification codes claimed was about 48. So this means we're getting more people the information they need to act more quickly. And that's key to slowing the spread of the disease. I also want to do a quick reminder here that testing is the first and foundational step to our strategy to stop these chains of transmission. So while we're standing up more tools in our toolbox, like the promise of vaccines, we still really encourage anyone in Washington state who has symptoms, who has been in close contact or thinks they might have been exposed to COVID-19 or might have COVID-19 to please get tested. Next, I'd like to share out our call for medical volunteers. As we move into the second year of the pandemic, we are in urgent need of professionally licensed volunteers to support some of our key COVID-19 response missions. Currently, our greatest need is for nursing professionals, people like registered nurses and nurse practitioners. We're also looking for doctors, physician assistants, pharmacists, and other medical professionals. As a volunteer, you could be asked to assist local facilities with vaccination, you could care for COVID-19 patients, or support medical staff or missions in other ways. If you're interested in assisting during a public health emergency, please register in Washington State's Registry of Volunteers called WASERV. The Department of Health will contact you with information on how you can support these missions and others in our communities. You can learn more at www.waserv Again, that website is www.waserv.org. Thanks, and back to you, Frangie.
Thank you, Deputy Secretary Ferenbach. Next, we'll go to Melanie Brandt, Chief Nursing Officer, Grays Harbor Community Hospital.
Good afternoon, and thank you for having me today. I would say that Grays Harbor County is seeing the same increase in COVID test numbers rising, and we understand that there is a huge need to have the vaccine pushed through to everybody in the different phases. And so we have, as of December 20th, vaccinated about half of the 1A phase group that we had identified, whether it was our employees, first responders, EMS, and community providers. And half of those have now received their second dose. So we understand the importance of getting that vaccine out there, and we are ready to, assist and do what we can to move on to the next phases. I will tell you, though, it takes a team. It's not just something that you can say one day that we're going to start vaccinating and have, vaccines in people's arms. So the team that we have had here at the hospital working has been registration, IT, nursing staff, people that we have, helping us out to do the observations afterwards. So it has been very rewarding, though, to see us get to that point where we are giving our second doses now to people that need it. And we learned a lot through our drive-through process that we had set up for our COVID testing to begin with. And so we've utilized a lot of those resources. Our employees are getting vaccinated within our walls, but the first responders, EMS, anybody out in the community, we are still utilizing our drive-up service for that. They get their vaccine, and then they are able to go to an observation area where a clinical member of our staff is observing them for their 15 minutes. We've worked really hard during our registration period to make sure that we're also getting that second dose scheduled within the time frame that is, required. We are using the Pfizer vaccine at this facility. We were able to obtain the cold storage to utilize that vaccine. I think our next steps when we look at moving forward to the next phase, we know that that's not something the hospital would be able to do on our own. And the Department of Health, the local Department of Health, and our facility, we are working in collaboration to put plans in place so that we can move forward with the phase 1B as soon as possible. I think the biggest concern that I would bring forward is what's already been voiced, making sure that we have enough vaccines to be able to get to those thousands of people that, are already starting to call and wondering, when that vaccine is going to be available. Thank you.
Thank you, Melanie. And next we'll go to Dr. Kira Mosseth.
Good afternoon, everybody. I'll be brief today. I wanted to share a little information about anger and de-escalation because that's something that we're certainly seeing a lot of right now. As I've mentioned previously, during the winter months, we're in this very challenging disillusionment phase of the pandemic response and recovery cycle, and that can come with a number of behavioral health challenges. So learning about effective de-escalation for ourselves and others can help us regulate sort of our emotional response, which is obviously a common difficulty right now for a lot of us, as we're getting into this 10-month of response. So it's important to learn how to calm ourselves down and de-escalate other people that we also encounter who may be struggling with anger or frustration as well. So I'm going to share with you a model that is all about this. It's called the SAFE model. and SAFE stands for self, area awareness, feelings, and engagement. So the first part is maybe the most important. It's about tuning into yourself, being aware of your own reactions when someone is angry or hostile. Pay attention to the tone of your voice, your body language, your word choice. Monitor your own sort of nonverbals, your posture, even if the words become personal. So nonverbal messages are particularly important, and beware of the things that you are expressing to the other person, even without words. The A in SAFE is for area awareness. Pay attention to your physical surroundings. Notice the space and the people if you are working in proximity with others. Your general area includes exits, potential weapons, available help, and other resources. It's a common misconception that you need to be closest to the door if you're confronting or working with a hostile person. Ideally, both people would have equal access to an exit, but you don't want an angry or hostile person to have to go through you to get out. So access to exits is important for anybody who is angry or worked up. F in SAFE is for feelings. If you can, try to ask questions and use active listening skills to identify what's happening underneath the anger. Anger is often, very often in fact, about an underlying emotion that's more difficult for people to experience. It's frequently fear or sadness, and it's coming out as anger for a lot of different reasons. So by listening for the feelings underneath the anger, it's often possible to identify the cause of what's going on underneath that for folks. And it's a lot easier to empathize when someone's upset, when you can understand what they may be worried or distressed about underneath. Finally, E in SAFE is for engagement. If it's safe to do so, connect with the angry person by engaging to understand their story. Don't dismiss them or their concerns. Try and engage resources or other people or information that can also help. And then the second part of that is to engage support for yourself. If you're in the position to be dealing with an angry person, or if you have a confrontation, don't keep that to yourself. Share it with someone, get some support, engage your own resources in order to increase resilience. Remember that if an angry person has reached a point where they've become physically dangerous and your safety may be at risk, do not attempt to handle that on your own. Use area awareness to find an exit and seek help around you. Don't put yourself in a situation where your physical safety is potentially at risk. That's the primary goal, is safety. Practice a pause before you respond. Just take a moment, whether that's to coworkers or for strangers, family members, or even in your own head. Just take a minute, take a breath before responding, and use the SAFE model to help de-escalate if that's what's needed. That's it for me today. Thank you, Frangie.
Thank you, Dr. Mossad. And now this brings us to the Q&A segment of today's media briefing. We do have several media with questions today. If we're not able to get to your question, please do reach out to us at doh-pio@doh.wa.gov. Our first question today comes from Anna Boyko-Wyrock with KUOW.
Hi there. Could you guys talk about what you're waiting for, what needs to happen to launch Phase 1B?
Sure. Thanks for that question, Anna, and I'll let Michelle add some additional details to this. A few things that are happening behind the scenes. One, we're obviously, as Michelle has mentioned, we're actively monitoring the number of vaccines that are being administered, and so I think that is obviously the key driver. We want to have a sufficient number of individuals that are in the first phase 1A, to be vaccinated, and we want to not open up where we get to a point, the next phase is where we get to a point where those healthcare workers are not able to get vaccinated because, again, there's a limited supply of vaccines. But again, that's the reason that Michelle described the absolute importance of getting healthcare workers, especially, this is a reminder, Dr. Lindquist and I have discussed this at length. This is a reminder to our healthcare worker partners that if you are hesitating or wondering if maybe you're not going to get vaccinated, this is the time to get your vaccine appointment so you can get vaccinated. That's the first piece of this. The second piece of this is that we're having those real behind the scenes discussions with our partners just to make sure that we're on the same page with what's happening, not just in the urban communities, but also in rural communities on the western side of the state, the eastern side of the state, and also what's happening in our healthcare system, as well as our public health system. So just having those discussions, having a better understanding of the lay of the land is also helping drive the decision in terms of the timing of opening up that next 1B phase. Michelle, anything you wanted to add?
just two pieces I want to add. I know it's been a challenge with limited supply to match exactly the vaccine right where the demand is. And so one of the things we've done is making sure we have accurate information on which healthcare providers still have vaccine, and then and what their plans are for using that, and then where places where there may not be enough vaccine and there is still 1A groups who need to be vaccinated. So this week we're working on moving vaccine around the state to make sure it is in the right place as we ask the remaining healthcare workers to come forward. And when we turn on the spigot, to 1B, it doesn't cut off the group of 1A. We would ask that people continue to get vaccinated. There'll be people who definitely need to keep coming back for a second dose. But really, we're just giving a few more days to match the supply with the demand and to do our best to help the remaining groups get through that are eligible in 1A. And another piece I'll just say is we're really working with our healthcare system partners, and we've asked them to make sure they're opening up to offer vaccine to anybody in their community who has not been vaccinated yet, who's eligible in 1A. So just giving a final few days to get all those things together and to get as many 1A people through before we start moving on to the next group.
All right. Our next question comes from Ariel Dreher with the Spokesman Review.
Great, thank you. My question is probably for Dr. Shah or Michelle. I'm hoping you can give us a little bit more details on your response to the federal announcements yesterday. Specifically, I'm interested in if Phase 1B will open up to all residents 65 years and older. And also if you could comment on the HHS and CDC's plans to prioritize states based on how many doses have been administered, as well as their plans to not hold back second doses anymore. Thank you.
Yeah, Ariel, thanks for that set of questions. And Michelle, obviously, just please add to what I may miss. And this also may move towards Lacy and Dr. Lindquist as well if they want to add anything to this. But in general, as I said in my remarks, one of the concerns that we have is that when you do not have enough vaccine supply, which is what the challenge is, right? We do not have enough vaccine supply from the federal government, pharmaceutical companies coming into the various states to make a pronouncement that does not give us specificity to say that we're considering opening up additional age categories, for example, gives us pause. And the reason it gives us pause, as I mentioned, is that, again, you don't have enough vaccines, but what you're doing essentially is opening up, if it's a queue or a line, you're making the line longer, but you're not actually helping people get vaccines because there's not enough supply. So we want our federal partners to really work to get the federal supply enhanced and to be consistent and to be timely. And those three things are not happening. We are finding out just a few days before what the supply is that's going to be coming into the state. In addition to that, we're also not assured of what the consistent amount of vaccine that's coming in. The second piece of it is that we also want to continue to focus on those who we think are the most likely to be impacted by COVID disease, meaning the most vulnerable. And that's what our focus has been from the state standpoint throughout the last several weeks to months, has been trying to devise who are the ones that are more likely to have an adverse event if they were unfortunately infected with COVID-19. And that's where vaccine comes in to prevent somebody from getting infected, right? We don't want somebody who is going to be infected to get sick, to have to go to a hospital, get really sick, and unfortunately have a negative outcome. That is why we're wanting to prioritize in the way that we have. As far as the second dose goes, what we've really talked about is that we absolutely want to have our federal partners be able to get more vaccines out to communities and to states. That's what I've just said. But we also want to make sure that we follow the science. And the science still says that of the clinical trials that were done on these two vaccines, that it was really with the intent of having 2 vaccine doses, so you would have enough immunity, enough protection from the second dose, and either 94.1%, 95%, depending on the vaccine, that you have enough protection, but it requires the second dose. We don't want that necessarily to be the driving force. Now, we're continuing to look at the science, the information, and we're also looking at what our partners across the federal and other partners are providing in terms of information, which will allow us to make additional decisions. But at this point, we're remaining with our commitment to get that second dose into the arms of people. Dr. Lindquist, Michelle, anything if you wanted to add?
Nope.
I'll just say, yeah, the only thing I can add is, not having enough information on these sudden announcements makes it really hard on the front line. We have our healthcare system both protecting us and treating us from COVID disease and delivering these vaccines. And so we need information on the long-term stable vaccine supply. Like Dr. Shah said, right now what we have from the federal government is a week-to-week number with no insight into long-term projections. So that absolutely has to be resolved, so we can better understand what's coming, and so we can all structure our vaccine programs in the future to the amount of doses that are going to be available.
All right, our next question comes from Megan Campbell with the Puget Sound Business Journal.
Hi there. I have a couple of questions, but I'll start with, I think I missed it. How many vaccines have actually been received by the state, and what percentage of the phase 1A population has been vaccinated?
So great. So right now in Washington State, as of this afternoon, we've had 624,975 doses of vaccine delivered to Washington. And as of the end of the day on January 11th, we have 660,000 total doses administered and reported to the state. So that's around 32% of the vaccine that's been delivered to the state that has been administered. One of the other pieces we're looking at is the rate of growth every day in the number of vaccines, in which we are seeing that increase. So we're now giving each day in our state between 15 and 20,000 doses. So that's pretty amazing over the first 5 weeks from when we started off for just a few hundred to a couple thousand till now, between 15 and 20,000 doses happening each day.
Wonderful. Am I still on?
Yep.
Yes.
Thank you. Okay. I was wondering, Dr. Shah, you're talking about working with partners. I was wondering if that included businesses and what specific ways businesses can help with this vaccine effort.
Yeah, Megan, thanks for that. And one thing that Michelle did not add, and if I could just add that she implied with the number of doses that were administered, and she gave a bit of a lag in terms of as of January 11th, close of business or end of the day. The other thing that we are noting is that when she gives the number about the number of vaccines that are administered, that is the minimum number of vaccines that are administered. There appears to be an additional time lag before the doses that are administered are reported into the state. And that means that there may be, and there are more doses that have been administered than the 201,000 that she quoted, because we know that there is that additional lag into the reporting system. So I just wanted to clarify that. This is all of community. We're in it together. I mean, we cannot do government, and in my 20 plus years of working in various systems across the country, I will tell you that government cannot do it alone. It is an all of community approach. And so we have to work with our businesses. When it comes to specificity and specific steps, we're actually in active discussions with the governor's office. And really the great, fantastic news is that we've gotten just this incredible, real interest from our business community in wanting to be a part of the solution when it comes to vaccine distribution or even administration. And so that's what we're working on with the governor's office, is really to how do we harness that power of our business sector to be able to harness it in a way that is not just on the sidelines, but it's going to help all of us get vaccines to Washingtonians as fast as possible. So those are things that we're working on right now. Active discussions, specific steps related to how do we harness that power, and then really ultimately how do we bring the business community together so they can work with us so we can get vaccines out quickly.
The one other thing I'll add is that businesses are an incredibly important site for vaccine administration. So we know every year during the flu season for healthy adults, one of the most common places for them to get their flu vaccine is in their place of work. And so we're working with the business community for when it's their workers' turn in line, that how can they deliver vaccines to their employees. Many already have employee health programs, or they bring people in to give flu vaccines. And so how do we have them ready to go to vaccinate their employees and potentially their employees' families at their place of work? And that's going to be really important for us, making sure there's multiple places for people to go vaccinated.
All right, our next question comes from Hannah Scott with Cairo Radio.
Hi, for really the health secretary or Michelle, anyone who would like to answer. You mentioned that the changes from the federal government, from the CDC that came out yesterday to the media, that those created some more uncertainty. There's a lot of, I'm assuming for you guys, but there's also a lot of uncertainty still, I think, among the public. What would you say to those people who are trying to figure out why we're so far behind and they're saying to go with those that are 65 and over and kind of changing the plan?
You know, first of all, Hannah, thanks for that question. Look, I'm coming from a number of different perspectives, and one of those perspectives is really another knowledge base of what's happening in other states across the country. And there is absolutely what we want our public to ask of us, which is to get vaccines out faster. But we have to do it well, and we have to do it right. We do not do it well or right as a system. I don't mean just the state, but as a system, that is going to just start all of the various things that you've seen across the country, whether it's people in lines or whether it's systems that are overwhelmed or even crashing, or just some level of misunderstanding, frustration, or even chaos in the public. And we do not want to have that. So our message to the public is, look, we're going as fast as we can, but we need to do better. And we are doing better, and we are going to do even better. However, we also want to do it well. We do not do it well, we are going to have a system that is not going to respond well. And then all of us are going to be having discussions in a few weeks about why did we open up too quickly, or why did we do some of these things that really made a more chaotic system in place. And we do not want to see that either. So it's trying to achieve a balance. And that's what we're working to strike, is the balance. So to our community, we want to say we're on it, but we also want to say that, realize that it's the balance that is the key to success for the future.
Our next question comes from Evan Bush with the Seattle Times.
Hi, we're curious what category of vaccine provider, pharmacies in the state program, hospitals, outpatient providers, the CVS Walgreens program has administered the lowest share of their vaccines, the lowest proportion. We're trying to understand better the gap between distribution and administration. Which category is the one of concern, and could you provide specific numbers for that?
Evan, are you talking about the federal long-term care program with CVS and Walgreens?
I'm talking about the proportion in these specific categories, hospitals or outpatient clinics, CVS, long-term care. What proportion, which category is lagging in administration versus distribution?
So as we work to get more vaccine into the community, we're going to need to make sure there's multiple places where that vaccine is located. So you've mentioned health systems and pharmacies. Obviously, I've mentioned employer-based clinics. And obviously then local community-based clinics, potentially mobile vaccine, and then the mass throughput, mass vaccination clinics are all strategies we're going to need to deploy. Where most of the vaccine is right now is all in the healthcare system. So we have some vaccine in pharmacies. It's a limited amount, mostly targeting the long-term care facilities that was not moving as quickly as we would have liked. And so the governor and I and some other staff met with CVS and Walgreens this week to continue to talk about their commitment. And they are really committed to 3 weeks to get visits done for each group of facilities. So for skilled nursing facilities and then for all the other assisted living type of facilities. So that's one area of concern. And we're seeing the pace within CVS and Walgreens continue. So if you want to follow up, we can share some the specific numbers that we got for CVS and Walgreens and of where they're at in that process. And then obviously the rest of the vaccine is really largely in the healthcare system. And so we're working to figure out, this is our mission to get vaccines to people, as we've talked about. And obviously we've said there's some reporting delays because this data, as healthcare providers are getting vaccine into arms, the data is in multiple different places and they need to compile that and get it to the state. So we're working to assess where those gaps are and find real-time solutions to getting doses reported to the state caught up with the level of doses they've given in the community.
All right, our next question comes from Keith Eldridge with Como.
Yeah, for Dr. Shah, 32% or a little bit higher is not very much. It's the same as last week. What is the holdup? And given the new guidance out of the federal government, you've asked for a federal strategy all along. Why not accept it? And do you believe the Trump administration is setting you up for failure with this?
Keith, thanks for that question. Look, federal strategy does not mean a pronouncement and no details. Federal strategy actually means working with states and locals to really work with those partners to really understand what the strategy is and to be able to actually execute on that. It is about details. It is not just about making an announcement and say we're making it and we walk away from it. And this has been something that I have championed throughout this pandemic, is that we need national strategies on everything related to testing and contact tracing and epidemiologic investigation. And now it's vaccines. That has not changed. So that announcement yesterday, or set of announcements, is not a strategy. That is just discussion. That's just putting things out there. We need to have strategy. As far as the 32% of Michelle, I don't have the percentage, so there, that may be a little bit higher. I want to make sure that we have the right percentage number. Look, it's not enough, and we have said that, and that's what I've said in my remarks. We've got to do better, and we are going to do better. The holdup is multifold. One of it is, the vaccines getting to the state, like I said, in a way that gives us enough opportunity to plan. It's very simple in the sense that, if you have a system that you build, it's like driving a car on a freeway. If you build a system and your car can go faster, but you have a speed limit, so your car is not able to go any faster. It doesn't matter if it can go 10 times faster. You have a speed limit that you can't go faster than. Our speed limit is the number of vaccines on a consistent basis coming into the state. When we do not have that enhanced system, then we do not have the ability to plan for this bigger initiatives, because we don't have enough of that vaccine there. Now, the other thing that we're working on behind the scenes is really to determine how much of that vaccine that you described, it makes it sound like, gosh, the vast majority has not been administered. Well, the vast majority of vaccine is actually somewhere in the system. It's whether it's in the shelf of a provider, whether it's being ready to be given in a room of a provider, whether it's in a hospital system, or whether it's somewhere in between. So we know that there is vaccine there, but what we have to do is also to get better information, and we're working to get better information from our providers where we have gotten vaccine to understand and to know how much vaccine they have actually administered. So there's a lot that we're doing behind the scenes. We are actively engaged engaged in this. And I'm telling you, I have been the last few days from visits in Tukwila and Seattle and in Pierce County, and I was in Mason County just earlier. I'm telling you, wherever I've gone, the number one thing we have heard from our partners and our community members is vaccines. And that is what we are committed to focus on and working through.
The other thing I'll add is there is growth. So, and when you see our charts that we need to get out, our new data display, you're going to see that information. So one of the reasons we know there is growth is the amount of vaccines being reported to the state each day. Remember, we're only getting 90 to 95,000 doses of vaccine a week. If you break that out at 95,000, that's 13,500 doses a day. Like I said, now we are up to giving between 15 to 20,000 doses in the state each day that are being reported to the state. So we actually have caught up to the amount of vaccine that is being delivered to the state. We still need to go back and figure out, like Dr. Shah said, where is the reporting delays? Where are the doses that have been administered and not been reported to the state? But what I can tell you today is the amount of vaccines being given in the state amounts the amount of vaccines that is available to us.
All right, this concludes the question and answer segment of our briefing. And now we'll go to Secretary Shah for closing remarks.
I just want to thank all of you for being on this briefing, and also to members, colleagues that are on the briefing here, Department of Health staff members. Obviously, Melanie, thank you for being a frontline provider and to really be here with us to share your perspectives, because ultimately it's not just about any of us, it's about all of us, and we are all in this together. There's a lot that we are working behind the scenes every day, and we're making incredible progress, but we are not where we need to be, and we're committed to getting there. And that's what Governor Inslee has been working on. As you know, he talked about it in his State of the State today during the inauguration, and certainly we're working with him, his office, and all of our partners across the system so we can make sure that we get as much vaccine as fast as possible into the arms of Washingtonians. That's what we're committed to, and that's what we're working towards. So thank you so much. Continue to work with us, continue to give us feedback, and we're going to continue to do better until we get it where we all want it to be. Thank you, Frangie.
All right, this concludes today's media availability. I'd like to thank our panelists for their time today, and TBW for hosting today's live stream and archives of past briefings. Thank you all, and take care.